Hello, everyone. My name is Megan Mason. I'm going to go ahead and get started. Thank you all for joining us this afternoon. Definitely want to make sure that we thank the students for taking time out to just gain some insight on their public health sector, as well as the panelists and everyone else that decided to be a part of this Zoom meeting today. I do want you all to know that this is recorded, so keep that in mind. And we're just going to go ahead. I'll introduce myself first, and then I'll let some of the team go ahead and introduce themselves as well. And then we'll go ahead and ask the panelists to introduce themselves after everyone else has. So my name is Megan Mason. I am the Assistant Director, Career Consultant in the UAB Career Center. And my job is basically to help students as they transition from college to career. So making sure that they are career ready, making sure that they understand the importance of interviewing. They know what an effective resume looks like. They understand personal branding, everything that's career related. I like to tell people I'm their coach and their cheerleader. So I'm coaching them and cheering them along the way. So Luke, I'll let you go next.
My name is Luke Hansen, and I'm with the Office of Public Health Practice. My colleague, Mina Nababi, is also on the call. And we do a lot of different things in the School of Public Health, but especially as it relates to you guys and getting experience in the real world, we oversee the internship process. So as that's something y'all begin to engage in, or as you look for other opportunities to get your feet wet outside of the classroom and in the community, we can work with you to help set you up both with those more informal opportunities, and then as you take those next steps into doing your formal internship.
Okay, thank you. Sarah?
So I'm Sarah Hendren. I'm the Alumni Affairs Specialist here for the School of Public Health at UAB. I already see some familiar faces, and I'm happy to meet some of the others that I have not met yet. But my role here is certainly to support our alumni and also our future alumni, trying to make connections and make sure that we have resources and kind of provide back to the alumni, and then try to create these bridges just like we're here today. So thanks so much.
Thank you. Jeremy?
Hey, good afternoon, everyone. My name is Jeremy Urban. I am the Assistant Director of Employee Recruitment. Along with Neil and myself, we partner with our employers to make sure that they consider UAB students for job opportunity, internship opportunities, and so forth. So making those right connections with those employers to make sure that our students are front of their mind when they're thinking about offering job opportunities and internship opportunities. So I'm glad to be here.
Thank you. Neil?
My name is Neil Adams. I work, like Jeremy said, in the Career Center here at UAB, and I serve as the Assistant Director of Employer Engagement. And so I work more specifically with some of the events that take place here through the Career Center, as well as our job platform Handshake. And I'm really excited for this afternoon and eager to gain some insights myself. So thanks students, and thanks panelists as well.
Thank you. Have two more. Mina, would you like to say anything?
Hello, everyone. My name is Mina Nabavi. I work with Luke Hansen in the Office of Public Health Practice. Good to see some of our alums on the call today.
Awesome. Ebony? I think that's the last one.
Yes, thanks. I am Ebony Harris. I'm the Director of Development for the School of Public Health. I work alongside Sarah to engage our alumni, and then also to work with our alumni if they're ever interested in making a gift to support student scholarships and other endeavors that we do at the school. But it's nice to meet everyone.
Awesome. So before we introduce the panelists, if you could, all the students, go ahead and put your Blazer ID in the chat for me, please. And I'm just going to go ahead and let our panelists introduce themselves first. So who do we have? Laura, if you could.
Good afternoon, everybody. My name is Laura Gilmore. I'm the Executive Director of Hub Worldwide. It's an organization that we started in 2019. I'll tell you a little bit more about it as we go through the presentation.
Okay. Corey?
Hey, good afternoon, everyone. My name is Corey Wiggins, UAB alum. I currently serve as the Executive Director for the Mississippi NAACP, and definitely looking forward to this conversation and sharing with students.
Thank you. Thank you. Bianca.
Good afternoon, everyone. I'm Bianca Presley. I'm the Vice President of Health Strategies for the American Heart Association. And I definitely am looking forward to being able to tell you more about not just this position, but our organization and how public health really ties into what we're doing in this cardiovascular research realm.
We're going to go ahead and dive into the questions. So, Bianca, I'll let you go ahead and start. How did you experience how did your experience here at UAB Public Health help you find your first position after graduation?
Actually, it was very integral. So during my public health career as a student, I was actually able to meet a lot of the minority health and research Minority Health Disparities and Research Center employees at the MHRC, that's in the School of Medicine and Preventive Medicine. And so I was able to have those conversations with them during my studies, and during that conversation and them really getting to understand my passions and what I was looking forward to, they actually found a position for me. So it wasn't a position at the moment, but they created a position to where I could walk into that position with UAB. So upon graduation, I moved straight into that position with this group of people that I had been working with throughout my student career. And so it was an easy transition. A lot of networking happened while I was in the public health program. And through those networks, I literally walked into a job my first day after graduation.
Oh, wow. Awesome. Awesome. Corey, could you tell us a little bit about how this experience helped you find your first position after graduation?
As I was thinking about that question, I think the thing that really helped me the most was my experiences that I had in the classroom. I did I'm not sure they still had a program now. I did the MSPH in health policy there before I went to the School of Ed for the health promotion PhD program. But as students, the camaraderie of students, the dialogue and the conversation, we really challenged each other in the classroom in our discussion, and really sort of pushing ourselves to think broadly. I think and the discipline of public health being very diverse in the context of whether it's data, policy, behavioral, epi, all of those sort of coming together really sort of helped me it really opened up the possibilities of what the next thing could be. I mean, I really wanted to use all of that and have a very sort of macro level approach of how I think about health and think about sort of quality of life. My first job out, I went into sort of public health consulting, working across the country with programs who were trying to do like macro policy change work at the community level. And really sort of shortly right after that, which was right after that, went in and worked for the Mississippi State Legislature. And so all of the data analysis, all the work that we learned in public health was right on target and point for that opportunity.
Awesome. Laura, I'll let you go.
My journey is a little bit different from some of the folks on the panel today. I was in healthcare sales for 20 years and decided a little bit later in life that I was making great money and enjoying what I was doing, but I really wanted to do something I was more passionate about. So I went back to school. I went back to UAB and got my MBA and a global health certificate. And part of that was really because I wanted, like I said, I wanted to do something I was passionate about, and it enabled me to learn a lot in both programs about kind of narrow down what I wanted to do and work with my fellow classmates on different projects and really have a better understanding of the need that I really wanted to meet. So like I said, mine's a little bit different from everybody else, but I fully enjoyed all the classes that I took and the friendships that I made and the people that I worked with and the professors.
Awesome. Okay. So the second question, let's see. If you had to do it all over again, what would you do differently? And I'll let anyone go first.
I can go ahead and go. So when I started my master's program after my bachelor's at UAB, I actually went into a MSW MPH program. It was a dual degree program between the University of Alabama and the University of Alabama at Birmingham, UAB. And so I was dead set on being a social worker. I was going to save the children. I was going to rewrite policies so that no child was ever going to be hurt or put in harm's way again. I had these grand visions. And then I did my first internship with my MSW program at DHR. I did not last 2 weeks. And I was very grateful that I was a part of the MPH program, because then it gave me another side of everything where I realized everything doesn't have to be micro. Everything doesn't have to be person to person. My MPH program really opened my eyes to see that macro level change affects more people than that micro level one-on-one intervention. And so one thing that I definitely would change, I would keep my passion for children. I would keep my passion for change, but I definitely would skip the MSW program and go straight into the MPH program and keep my focus on the public health perspective of what the problems were that I was seeing in the community. Because I do feel like while I did gain information from the MSW program, the core of what I'm doing and the heart of my real passion is in public health and policy work, because I do want to make that large, impactful change in the communities that I'm serving. So that's something I definitely would do a little bit different.
Anyone else want to answer that question?
I'll pipe in. I think Bianca had an excellent point that she made, and in that she said, you know, I found out what I didn't want to do, and I think that's really key for anybody that's going through any program and is in classes right now. Part of the challenge for you on deciding what you want to do or what you think you might want to do for your life is deciding definitely what you don't want to do or what you don't enjoy. And I've got 2 sons, and I have told them that repeatedly. I said, first of all, do something you're passionate about, because when you get to be 30 and 40 and older, you want to make sure that you feel like you're making a difference in the world and not just getting a paycheck. And also just, you know, when they were trying to figure out what they wanted to do, that's what I told them. I said, find out what you know, make a list of what you don't want to do. And then it's going to be a lot easier to figure out what you really want to do based on how you're wired, you know, internally and what you're passionate about.
I was just thinking about my answer to that question. I don't know if this is good for faculty or not, but I think the thing that I would have did was differently. I did some of this, and I think I would have said do a little bit more is raise more hell as a student. And I say raise more hell as a student in the context of this idea of, right, like what you learn in public health is real wide and vast, and the skill sets in which you develop can be used in any setting, in any frames. I know Bianca talked about the macro, and that's the space that I spend most of my time in, looking at macro level, like system change type strategy, systems change type work. But I've been able to leverage like my experience and the things I learned in public health to do a lot of different things. So like being a policy advisor in the state legislature, to being senior vice president of policy within a financial institution, and led a think tank that did fiscal policy, public health policy, education policy across 4 states, to, you know, former professor and now at NAACP. But all of that basis is really around this framework around like social determinants and quality of life, like, and health encompasses all of that. And so I think, you know, as a student, I would sort of push myself as a student. I would encourage you to push each other, and also to push faculty to really bring in the diversity of the opportunity in which you have the opportunity you have to have impact in whatever area of work that you go into.
So one of the things that we stress here, and I'm glad that you guys are tapping into a lot of, that is not a perfect career path. There's no such thing as a perfect career path. And going into the next question, how did you guys what was your first job after graduation, and how did you go about getting that position? Because a lot of our students struggle with what to do next after they graduate. So if you guys can kind of touch on that. Laura, I'll let you start first.
Well, mine is a little bit different in that, I had a career in sales for many years, and then I went back to school, and based on something I was passionate about, because I started a nonprofit is what I did. I finished the programs, both programs, and then started it January 2019. And the nonprofit is called Hub Worldwide. And basically what we do is we collect unused and surplus medical supplies and equipment, and we distribute them to under-resourced communities. So it's a twofold thing that we're trying to do. We're trying to eliminate waste in landfills from the hospitals and medical providers, and we're trying to use those supplies and equipment for communities in need. So the way I got it, I basically started the nonprofit. It's been a whole heck of a lot harder than I anticipated. Very, very challenging, but it's been very rewarding because we've been able to set the stage for future success. We've been able to distribute supplies and equipment. The first year was really kind of a building stage of capacity building for getting a warehouse, getting some support, getting the board together. The second year, we distributed over $30,000 worth of supplies and equipment. And then this year, we've actually distributed over 60 with the anticipation that we'll have at least one more project to do this fall. So that's mine in a nutshell.
All right, Bianca.
So as I mentioned, so once I graduated from the dual degree program, the last degree I got was the MPH. I had been in contact with Dr. Mona Fouad, who's in the MHRC in the Division of Preventive Medicine, really telling her about my passions and trying to understand how I'm going to use both of these degrees because I paid for them, and we're definitely going to use them. And so just telling her my passions and what I'm good at and what I really excelled in during my MPH program. We came up with a program coordinator position. It was a grant position under the Gulf States Health Policy Center under Dr. Regina Benjamin. They created that position because it allowed me to look at policy work in the health sector. And then it also allowed me to do some summer camps with younger students, early college students, to prep them for the medical field, the research field. And so they created that position for me. Like I said, it was conversation, making those connections, utilizing opportunities on campus when there's not just career fairs, but when there's mentor fairs, when there are campus tours, when you're able to see the different divisions on campus, just utilizing those opportunities and making those connections. I did that for a couple of years, and then I went into a program manager position from the coordinator position. I did that one for a few years, and then from the coordinator position for community outreach. So I moved from the policy work to the community outreach work. Because of all of those connections that I was making on that position, I was then, tapped by the American Heart Association to then become the community impact director for the Birmingham market. And so I didn't want to leave UAB because it was a position that they made for me, and I loved it. And so it was a hard decision, but I did make that decision because, I don't know if you know, but grant money is soft money. So if the grants don't come in, you don't have the position. And so it was a hard move, but a good move for me. And so I worked the community impact director position for a year, and then I was promoted to the vice president of health strategies, where I was able to not just look at policies and look at system changes, not just within Birmingham, but the state. I was also able to get a little bit of micro because I'm a people person. I like talking with people, moving with people, working with people. And so I was still able to go into those communities, have those conversations, work alongside them, implementing different health strategies based on our research. I was able to do that, and that's what I've been doing for the last few years. So that's kind of the progression of my career path from just the public health. And I will say, while I may not have necessarily, would I have done social work again? I don't think I would, but I did learn a few things that really serve me in the community when I'm working in my person and environment capacity. So but I'm definitely using a lot of public health, statistical analysis, epi work. You're going to use all the research methods. You will definitely use all of that information in the real world. It may not look like the test that you take in your class, but you'll definitely be utilizing all of those skills in one way or another.
Awesome. That was excellent. You're definitely tapping in. And guys, students, I hope you guys are listening to these nuggets, man. This is some good stuff. Corey.
Yeah, I mean, I think a couple things. I think the way I would sort of frame it is that while you're at UAB, you're getting a world-class education in the School of Public Health. And I say that because the skills that you learn there can be applied in any sector. And so from that framing, when I would go in and went into sort of one of my first interviews, it was around talking about the skills that I developed and learned in the context of analysis. And so much of and analysis, not only in the context of being able to analyze data, but analysis in the context that you are equipped with different types of frameworks, whether it's at the micro to the macro level of like how to process information, because so much of what we do nowadays is about information. But the people I think who can manage in this sort of work environment that we're in so many ways is people who have frameworks to process how that data comes in, what to do with it, and then how to synthesize it back out to whatever stakeholder that you're talking to. The other thing is that, as a student, there are so many opportunities, I think, even, prior to coming to graduate school or while you're at UAB, to get some real life experience and through internships. I was fortunate prior to coming to UAB, I ended up doing a fellowship in DC where I worked in a US Senate office doing health policy. That combined with the skill set, when I went into this interview, I had federal experience, right? And so I could go into a state legislature and say, hey, I know people at the federal level. I know how to track bills. I know how to track legislation. I know how to connect what's happening there back to the state level. And so that in itself, the internships, experiences, things that you could do. I remember as a student, I worked with the dean at the time where we brought in and did a symposium around the relationship around incarceration and health. So as a student, I always did like those more, as some folks may say, like non-traditional public health issues. I went outside of the disease specific of like, cardiovascular disease or obesity. I went into stuff like looking at the social determinants of health and the connection between issues around like racism, looking at it in the context around incarceration, making the case how, disparities in incarceration come from the same root issues that exist around disparities of health. But you have that ability to do that, right, in that frame. So I would say encourage folks to take advantage of that. And the last thing is relationships. I rely on and still communicate to some professors who are at UAB, staff who was at UAB. The thing that I would equip, even as you go into your professional life, this is sort of just my personal thing is that treat everybody with respect, meaning that the administrative assistants who are working in the offices of that you're going into on campus, treat them just like you would treat your professor. Because ultimately, when you go into the workplace, those are the folks who actually know what's going on within an organization, who will tell you how to find jobs, who's hiring, who's doing this. Like those are the folks who really put you in and get you connected. So you gotta, you can't get too big of yourself in the context of this stuff that you're learning in school and realize it still comes down to human decency.
Right. And that's what I try to tell students, that the Career Center, we're the plug. We basically, let you know what opportunities exist, and staying connected even after you graduate is so important to your career, even after you, move on beyond UAB. So as we're looking at, Corey, you tapped into the traits and characteristics and just the overall things that you need to do. So you guys individually, if someone was interested in the areas that you are currently in today, what are some of the traits and characteristics that they would need to develop in order to see the level of success that you've seen in your particular industry? And Bianca, you look like you just Dying to go first. I'll let you go first.
I was really thinking about it.
Yeah.
And I was just thinking about my own progression. And I think some things that have served me well in the growth in my career path have definitely been boldness. So being unafraid to talk about what you want. I think a lot of times as a new student who has just graduated, you're grasping at whatever comes your way, and you're just grateful to have a job, and you're grateful to just be in the career path, which is, not a bad thing. But tenacity and boldness to really speak about what it is that you want and what you see for your future will open a lot more doors. So I think that is something that definitely, I would definitely say students should have, because had I not had those conversations while I was a student with those mentors and with those faculty and staff at UAB, they would not have created that position. They would have not taken into account, and I would have missed that opportunity for this growth track. And so I think having that tenacity, having that boldness, and even if you don't know what you want, it goes back to what Laura says, know what you don't want, know what you are not willing to work through or with, given, who you are as a person. And so I definitely think that's one characteristic, but then also really knowing what you're talking about. So it's great that you passed your class. It's great that you got good grades, but really getting an understanding of what it is that the school is trying to teach you, the concepts, not the details of the material, but the concepts themselves will really serve you well, because in many of your positions, they're not asking you to regurgitate what it is that you've learned. They're asking you to apply it. And application is much different than regurgitation. So being able to take what you learned and apply it to a real life situation makes you an asset to any team or any organization. So definitely being able to do that will definitely have you stand apart from other people. And I can go on and on about things that, when I moved from my community impact director position to my VP position, I had to create the kind of description of the person that I was looking for. And these are things that I put in there. And I didn't ask about your grades. I wasn't really concerned about the recommendations. I wanted to know about your creativity. How did you master what you learned in school, and how are you applying it now? Because you don't wait to apply that information on the job. You apply it now, because that's how it becomes a part of your everyday vernacular, everyday understanding. And it's not a skill that you sharpen on the job. It's a skill that you use in your day-to-day life that then bleeds over into your job. And so those are a couple of things that I would say for a successful career path.
Bianca, those are some really good points. Kind of piggybacking on what she said, I liked what Corey was talking about when he mentioned, talking to professors and staying in touch. People that know me know that I'm a big networker, and I'm all about connecting people, whether somebody can benefit our organization or another organization, but I'm constantly thinking, how can I help this person get this job or get an introduction or whatever. So I think networking is key. You don't want to burn any bridges, obviously, on the way out the door. But I also think that it takes a lot of, you got to be courageous in some things that you're going to do. They're going to ask you, to potentially take on projects or whatever. And you have to be willing to step up and say, yeah, I want to do that. And if you don't know how to do it, then that's when A, you need to be honest, and B, you need to ask for help. I think as an executive director of an organization, when people that I work with, when I ask them to do something, I'll always say, do you know what you're doing, or do you need some help? And I really kind of rely on them to be honest with me. The last thing I would say, as far as developing success in any industry, is kind of going back to what we said earlier, and that is having a vision of what you want to do. And you may not know what you want to do 10 years down the road, but after you get out of the workforce and you've been working for a couple of years, you may say, you know what, not really keen on working in this area for a while, but I want to develop my skill sets and move into this area. And I think both Bianca and Corey have shown, and even in their journey, that they did that as well. So those are just a few of the points that I would like to bring up.
Yeah, I think you already just kind of addressed it in so many words, but if you want to jump in and add more.
Well, look, I think Bianca and Laura gave some great nuggets of stuff students do. What I was thinking about, I'm thinking about even more recently, right? So I work in the civil rights and advocacy space, and the other folks I come in contact with who I think are doing great work, others who may be struggling, or folks who are trying to get a sort of way into this work. I would say the difference is that probably folks who are committed to lifelong learning, right? I mean, you go to school, you learn a thing. Because you learn a thing doesn't make you an expert. Like that doesn't sort of put you at the top of the field and put you in advance any other person who's coming into that same space, or quite frankly, anybody who's been in that same space for 20 years. I think those folks who are looking at this as a process, heck, I used to talk to my students when I talked at Jackson State about this. I was like, it's very easy as a student to get focused on the outcome being whether I got an A or B. But what I care about or cared about as a professor is a process in which you utilize your brain and in your mind, and how analytical you were. You could come up in completely left field with a wrong answer. But what I'm mostly interested in is the analytical process that you use to get there. And so I think being committed to lifelong learning, I think sets anybody up to be successful in any of the spaces, to go along with everything that Bianca and Laura shared.
This is awesome. I'm hearing a lot of good information, and the importance of networking, the importance of boldness, building relationships. I have a question. I wanted to jump in and ask a question, but it's going to be a little bit off script. Jeremy probably can anticipate the question, but I've heard a lot of suggestions and kind of things that are good pieces of information for students to take into account as far as the journey. But I just wanted to see if you might be able to put yourself in the shoes of yourself as a college sophomore or college junior. Is there any encouragement or a suggestion or any type of encouragement you would give yourself at that time, just to kind of help improve the journey from then on out?
I do. I have something I'll share if I could jump in. And this is something I've learned sort of in my journey now and continue to learn, right? I think so often we ask people and talk about this question about what do you do, right? If you meet somebody and folks ask you, what do you do? And I think that's the wrong question. I think we should be asking people really about how do they feel. Also, right, in the sort of vision sort of part of it, we often ask students or talk to folks like, what do you want to be in life, or what career or what thing you want to do? I also say we should be asking people, well, how do you want to feel in life at whatever point that you're in? And so what I would say is, as a student, as I go back to as a college student, what I would sort of tell myself or advise myself is, instead of focusing on, don't get wrapped up in this thing about what it is I want to do. You're going to do whatever it is that you can, right? All people are trying to strive for success. You're going to do all these other things. But be real intentional about how you want to feel, right? In doing that work or doing whatever it is that you're putting around for you. If work-life balance is important, if all these things, I would sort of encourage is be in tune and be really sort of centered on what it is in terms of how you want to feel.
Love that. Thank you, Corey. Laura, Bianca, do y'all have anything to add there?
I think the only thing I would add, those were great points that Corey made. Don't be afraid to make mistakes. A lot of folks think, they see people doing successful things and they think, wow, they, either somebody helped them along, which is fine, but don't be afraid to make a mistake, because in the long run, I feel like when I look back over the things that I've done, whether they were successful or not, I've learned the most when I've made mistakes, or when I went down a path that I was like, I really didn't want to do this, and that's okay. Give yourself that space to explore and to determine, to kind of figure out what you want to do, where you want to be. And I agree with what Corey said. You can't look out and go, I want to do this for the rest of my life. You don't know. I mean, some people are fine with that. Personally, I'm not. I kind of look at my life in seasons. I was in sales for 20 years, which is actually a really long time. But, It's like my son is an actuary in Chicago, and he's already told me he's only been doing the job for about 5 years. Very stressful, strenuous job, making great money. But he said, I don't really want to do this the rest of my life. And I said, that's okay. You've got all these skill sets that you've learned in your position that you can transfer to any organization, including nonprofits or for-profit companies. So don't sell yourself short on learning stuff and also being willing to make mistakes.
I would just add, so I was thinking back on my own experience. I would say, make sure that you're balanced. Life is going to come at you very fast when you graduate. And you think school is hard, being able to problem solve on your job every single day is much harder than taking a test once every 3 or 4 weeks. So I would definitely say take this time to balance, figure out what work-life balance is now, because it is a very hard skill to pick up when you start a job. And so if you can start your career now with a work-life balance, really setting a schedule of how much time you study, how much time if you enjoy your friends, how much time you work, getting those skills now while you're in school will help when you get on the job, because I can tell you there are not really that many 8 to 5s. There are not that many clock in at 8, clock out at 5. You, especially when you get higher up in the levels of your job, you will definitely go from in at 8, out at 5 to emails at 7:30, starting work at 5:30, a couple emails on a Saturday afternoon. So figuring that out now, what your work-life balance is, while you have and I don't want to diminish anybody's school schedule, work schedule, life schedule, but while there's not as many irons in the fire, figuring that out now will definitely help you do your job better and have a more fulfilled life when you do get into the working sector. And you're not looking back 7 years, 5 years, 7 years later saying, I wish I would have done something different, or I, climb the corporate ladder but have nothing to show in my life. And so figuring that out now will definitely help you a little later on.
Awesome. Thank you all. And the something that we again try to help students understand is that this college time frame is not meant to be compartmentalized from your career. It's essentially one and the same. Like, you are in your early career stages right now, and so it's creating those good habits, starting to put yourself out there, people, build relationships. Now is the time to do it. Don't wait until, senior year or right after graduation, that type of thing. I did want to make sure that we have some time to address the question about, if applicable, what is the best way for students to find out about opportunities to work or intern at your respective organizations? And I'll let y'all just kind of jump in.
Our website, we are always posting positions. The great thing about the American Heart Association is we're international, so you can work from here to Spain, France, Puerto Rico, Argentina, wherever you want to go within the organization. They value public health. They value go-getters. They value tenacity. They value creators. And so, for our organization, we're always looking for people. It does not matter about, especially coming out with an MPH, our organization values that education. So you can, like I said, you can start mid-level within our organization with an MPH. And so I just say, look for those opportunities. When I was looking for a community impact director to take my position when I moved up to a VP position, I went to Dr. Allen, Shantice Allen at School of Public Health, because it was a connection that I had. And I said, do you have any students that, I gave her my description of what I was looking for. Do you have any students that fit this? And she just pushed it out to the to the students that she was connected to. So because I am an alumni, I definitely reach back to where I came from, because I believe that I want to go back to where I came from. So that's something that I do.
Laura, Cora, did y'all want to jump in with any suggestions about your organizations?
Sure. We're still a small organization, and as I alluded to earlier, we're a nonprofit. So we don't have any positions available right now. Down the road, I anticipate them. We do have internship opportunities that I can, I believe there was someone that reached out to me a couple of weeks ago. Her name can't think of it right now, but I was going to discuss with them about some potential internship opportunities next semester. So,
Awesome.
so we're still in the growing, growing stages of our organization.
We'd love to make sure you get some interns if possible. Go
Yeah,
ahead,
what
Corey.
what I was gonna say is I think I've worked with some years ago, had interns and other students in public health at the NAACP here in Mississippi. And I'll just sort of talk to it broadly, like, right, for students who are interested in public policy work, but public policy work or health policy or health advocacy, I mean, I think there's a lot of opportunities to get engaged, particularly right now. Some examples of places, you can always be the person who wants to do like the DC-based think tank work, which is, the primary type research piece, or you can do with some of the sort of advocacy type spaces. There's also a lot of, state-based organizations now that are doing like general policy and health policy work. When I think about Alabama, I know you got Alabama Arise that's there. They do some work. And I think Robin, who's over at the other sort of connected center to it. But most states have those types of organizations now. You take a state like Mississippi, where, we're one of the states who hadn't expanded Medicaid, right? There's a lot of advocacy work and opportunities to be involved in that in any number of states. So I would just say for folks who are interested in sort of the civil rights, health policy, advocacy type work, I'll drop my email address in the chat too, and folks can, follow up directly if you're trying to figure out what that landscape looks like nationally and in terms of like state-based work in that way.
Thank you so much for that. I do want to make sure that we can address some of the student questions. And so the first student question in the chat, if any of the panelists or perhaps anybody from the School of Public Health could address work in the federal government, such as USAID. Had a question about that.
I mean, I didn't do federal government. I did state government. What I would say for people, and I think Laura, I heard you mention about being at a nonprofit. Well, I guess in Bianca at American Heart, all of a sudden nonprofits, right? And for folks who've worked outside of the nonprofit space, whether it's for-profits and even in the government space, all of these sectors are very different. It is very different to work in government versus working in a nonprofit versus working in a for-profit sort of setting. Yeah, I'll just say it's very different. And as folks are trying to figure out what makes sense, what I advise and would advise students is actually get a little bit of taste of all of it, or as much of it as possible. Because I think if you've been in government and worked in government and worked at for-profit and come to a nonprofit, all of that helps, right? I see Laura shaking her head, like all of that comes into play. I would say, folks, don't just limit yourself to one sector. If you're open to multiple sectors, I encourage folks to go explore.
Excellent.
I'll say doing a little bit with the grant management and working a little bit with NIMHD, NIH, the CDC. So having worked with them for a couple years, it is a very analytical landscape. You must be on your P's and Q's. If you like reports, I will say there are a lot of reports. There's a lot of paper trailing. There is a lot of checks and balances. So knowing your personality, you should definitely look into that when you're looking into the federal government and the work that it does, because it's a lot less lenient than nonprofits or public sector, private sector, stateside jobs. And I think the state government's the same way as federal. It's just not as stringent, but it's pretty stringent. And so one mistake with the federal government, I remember I think I miscounted a group that we were doing for NIH for a grant that I was managing, and it literally put us in an audit for 4 months. Just one number that was off. So it's a lot more tedious. So I definitely would say really check your personality, really check your processes, just to make sure that it's compatible with that type of work environment.
And I'll hop in really quickly and say when I was a student in the school, I completed my internship with USAID. So if you are interested in a federal-based internship, just know you have to apply for those early on. My internship with them in the summer, I had to apply the previous October. So, you're looking about a year out in advance. And from speaking with other alums who work in the federal government, a lot of them got their foot in by being a federal contractor first, and then coming into the role as a federal employee. So if that's something that you're interested, look at those companies that are contractors for federal government agencies.
This is a great question. I think next up we have a student who's asking, just about this new landscape we're in with online classes, online networking, relationship building. Do you have any suggestions on building relationships and networking in the field, during this time where, we're in a pretty virtual landscape?
To some extent, it can be easier to network sort of in this space that we're in now versus, when you have to sort of have the big meetings and conferences. And I think maybe Bianca talked about being bold. And I think part of being bold is if you got an idea of things you're interested in learning about, look out, whether it's using LinkedIn, just Googling, searching who's doing that kind of work, and just email them. Right? Like yes, it'll be great. Like if you're asking around and talking to people and you got warm handoffs and warm touches on people who can advise. But honestly, it's been my experience, and I can know folks who are in the spaces, when people get emails from students and saying, hey, I'm a student, I'm looking at this, I'm trying to learn a little bit, folks actually do respond. Matter of fact, they will respond to those emails and will not respond to the important ones that require some brain power or some stuff they're like, I just don't want to deal with that today. And they would much rather spend time talking to a student about what it is that they want to do and what they're interested in. So I know it's different. You don't have the meetings, you don't have all that stuff, but I will say, utilizing, LinkedIn, utilizing email when you find these folks and just saying, hey, I'm a student, I'm considering this, people will respond to that too.
I'd have to say two things coming back on what you said, and I agree with LinkedIn. LinkedIn was going to be my answer. And my number one answer is LinkedIn. If you do not have a LinkedIn profile, you need to develop one. And it's way different from Facebook. So if you're not familiar with it, get familiar with how you need to set up, because you want to consider LinkedIn as your professional site. My LinkedIn profile looks extremely different from my Facebook profile, my personal one actually. And so it's a way to a couple of things with LinkedIn. You can put in there, what you're looking for. You can, talk about different projects you've done, internships, things like that. But one of the things that's really nice about LinkedIn is you can actually, the search feature enables you to search for groups within LinkedIn that you may be interested in. It could be, there's public health groups, there's all kinds of stuff out there. And that's one way where you can connect with people, because if you send someone a connection invite just so you can get to know them on LinkedIn or connect with them, they'll be more likely to connect with you if they see that you're part of the same group. So keep that in mind with LinkedIn. I've got a lot of people that I'm connected with on LinkedIn, and that's actually another way that recruiters will, keywords that you use in your profile, recruiters will look at that and they will, they'll ping you sometimes and say, hey, here's a job you might be interested in based on either your resume that you have uploaded there or keywords. So that's number one. The second one is something that we've talked about several times, and that is just using referrals. So you've got colleagues that you probably know that have already graduated, that are working in a place you might be interested in, or professors that have connections all over the world. And so what I would suggest is, ask one of your professors or your colleague to say, would you, I'm interested in this organization. Would you mind forwarding an email from me to them, to whoever, or copying you on it or whatever. That has been key for me in getting in some places where you know, if I just write somebody a cold email, it's going to end up in their spam. They're never going to answer it. But if somebody says, you know, Corey Wiggins suggested I contact you, and this was a place I wanted to go, then they're most likely going to open it. You know, so those are the two things that I would suggest that have been successful for me.
One thing that I would suggest is utilizing this virtual world that we live in now. So almost every company, every organization is having some sort of digital presentation or digital experience. And so being a part of them, showing up, because what they do is they look at the list of people that participated in those presentations, is definitely one way to get your name out there, but then also actively participating. So if there are opportunities for questions or even just responses to what those presenters are saying, being active in the chat definitely gives you the same, in this virtual world, gives you the same response as if you were in the crowd of a presentation and you asked questions or spoke up. So definitely not looking at it as something that's a detriment, but looking at it as this is just a shift in how I can respond and participate, but still reaching out for those opportunities. If there's a person on campus and you wanted them to be your mentor, you would go listen to their their lecture or their presentation, and you would show up to their opportunities. So do the same thing in this virtual setting so that they see you showing up, they see you putting forth the effort, and not only does your name show up on the roll, but they hear you speaking out and really actively engaging, and that kind of bubbles you up to the top when you do send that email or when you do reach out to them personally. It's, oh, I remember you asked that question or you said that statement. And so just making those connections whenever possible.
Thank you. Yeah, and it's absolutely true where accessibility definitely is improving, I think, in the virtual space. And for students, I just want to kind of reiterate some of the things that you're hearing. It's important to be open and reaching out to people, but what you're not hearing is to reach out and say, I need a job. You know, what you're hearing is reach out with a message and a connection to try and build a relationship with that person. And when you're utilizing resources like LinkedIn to connect with people who may have mutual friends or, you know, as indicated, are in mutual groups, or maybe even you can filter, other UAB graduates and kind of give that Go Blazers at the end of a message. So it's really important to consider the way that you approach that outreach as well. And I know we're getting close on time. I want to make sure that we're respectful of our panelists' time. Are there any quick words of advice for careers related to global health and public health analyst jobs? And then Megan, after this question is addressed, I'm going to turn it back over to you.
As I mentioned with the American Heart Association, we actually have global analyst positions within our organization. But I think a lot of times when you think the global analyst or global public health specialist positions, you're automatically thinking overseas and how, you have to be over there in the environment. A lot of those jobs are stateside that interact with those the countries or the regions that we're working with. And so I think, I think Laura and Corey have both said this, like, don't pigeonhole yourself into what it looks like in your mind because of what you preconceived based on your certificate and your education. Definitely think outside of the box because there are positions within the U.S. that have a global perspective that need the education expertise that you bring. So I would just, recommend that, but then, look at companies and organizations that are international that give you those opportunities as well.
The only thing I would add to that, those were great points, is that for the most part, any of the large organizations are looking at their analytics, obviously. And so there are lots of opportunities. And like she said, you don't have to go overseas to do stuff. You could do it here. So.
Awesome. So what a great discussion. Special thanks to our panelists and everyone that helped put this panel together. And just a few takeaways: be bold, keep networking, and continue to utilize your resources. Again, thank you all. Was there anyone else that had anything else to add? I want to definitely be respectful of everyone's time. Anyone else that had anything?
Hey, I thought of one thing I wanted to share real quickly. And this is more general, I guess, again, with public health, is we've all said it, like, don't limit yourself. And one example of how I'd explain don't limit yourself, we need more public, I think we need more public health folks in a lot of other spaces, whether it's in housing, whether it's people who are working in economics. people who are working any other the different transportation. We need folks we always talk about health in all policy, right? Quality of life, determinants of health. Part of making sure that happens is making sure that public health trained people are infused in all of these sectors. So I would encourage folks, as you're thinking about it, look at other sectors as potential opportunities as well too.
Thank you all. Hopefully we can do this again in the near future. Thank you for dedicating your time and being active. Thank you, students, for just taking out some time to invest in your future. So we appreciate you all. Everyone have a great day.